Hello, and thank you for joining us here at the First Alert Desk. I'm Maria Moreau. Today it is World Mental Health Day, a time that we first marked 30 years ago in 1992 to hold a conversation around mental health. And today we're actually talking with Dr. Lucinda DeMarco. She's the Chief Medical Officer for United Healthcare here in Georgia. Dr. DeMarco, thank you so much for joining us. Of course, today's conversation around mental health looks a lot different than it did 30 years ago when we first started marking this day. Talk to me a little bit about today's conversation around mental health versus what it was back in the 90s.
Well, back in the 90s, which was early at the time I kind of started practicing, we really didn't talk much about mental health. A lot of times I would have parents come in and ask me about their kids, but it was a very high level conversation, and we didn't really discuss exactly what was going on. Now, and I guess if we had to thank somebody, COVID maybe, I think it has brought it much more to the forefront and much easier to discuss moving forward. And there's also a whole lot more in the way of opportunity to be able to access mental health these days. There's virtual visits that you can utilize to gain mental health. There's much more advertising of groups out there that can provide mental health. I believe most of our workplaces have support services. You've got counselors at school. So it really and truly is something that can be discussed and needs to be discussed with your family and your friends. It's not taboo anymore.
I couldn't agree more. I really appreciate that you brought up the pandemic especially. That really was a time that a lot of people started talking about their mental health. More people were spending time at home. More resources online became available, or at least more noticeable to people as they were talking about their mental health and maybe their struggles with mental health. I wanted to ask you, both as a professional and someone who works oftentimes with people who face these struggles, why do you think this is such an ongoing issue if we have so many resources at our fingertips today?
Well, I think one of the things that the pandemic did was I think it made us look more into ourselves and really become more cognizant about what was going on. I mean, in essence, we had a chance to stop and say, what's good in our life, what's not good in our life, is there something I can do about it? And I think up until that point, we were just all going. And so I think that is something that I know, be it the pandemic and other sources that I've learned, I really have to look out for myself, make sure that I spend time on myself, and for my well-being. And so that's really kind of, I think, the thing that has made everybody become more cognizant of what's going on from a mental health standpoint. The other thing is I think that all ages are being affected. And so, we've all can tell stories of, unfortunately, kids that have committed suicide, middle-aged people who have committed suicide, and even elderly who have committed suicide. And I think the fact that there's been like a 4% increase in suicide over the last several years is really awful, and is something we should be doing something about. The places to go and the people to see and access to what you need is out there. You just have to reach out and grab it and hang on to it. There's nothing wrong with needing to talk to somebody who is not your family, who is not so close to the situation that they can't be rational about what they're saying and how they're helping you.
And we talk about
And we all need to help each other.
We do, absolutely. We talk about that statistic, with the growing rate of suicide, especially among teens and young adults. That's really the group most affected when we talk about suicidal tendencies and mental health struggles. How can parents who often, say, oh, it must be social media, or I'm just having trouble communicating with my teen and young adult, how can they help their young person who's struggling with mental health when it seems like they're just having trouble starting that conversation?
Well, I think, it's obviously when you're just starting because you think something's going on, it kind of makes it very suspect with your preteen and your teen. So it's really important all through their life to be having conversations with them and asking them, how are you doing? How are things going? And not all kids will open up at the point where you ask that question. So you really have to kind of stay on it and continue to ask them, how are things going? How are your friends? How are your studies going? What things really interest you, and get to really know your child so that if something is off. And that's the time really to dig, is if something is off, if they're acting out, or they're acting withdrawn or clingy, or, they were doing something they were really interested in and now they're not interested in that, those sorts of things. And you have to be cognizant of the fact that sometimes when they get in those situations, they may turn to other kids for help, they may turn to alcohol or drugs for help, and that may be your first indicator. And the key is really to kind of grasp onto them and really try to help them, but not do it in a negative, overbearing way. It's really difficult to do. It is. But practice makes perfect. You have to try. That's all you can do is try.
It sounds like making that conscious effort is really half the battle, or most of the battle. And we talk about suicide, which is already such a hard and difficult conversation to have around mental health. But what are some of the biggest warning signs initially that parents can look out for so they can start that conversation sooner rather than later? Because oftentimes you hear, I never knew they were in a bad place mentally, and then it's too late.
The bad thing is I think none of us want to think that anybody that we know would ever consider suicide. So if the words in any way, shape, or form come out of their mouth like, I want to be dead, or I want to kill myself, or, I really don't need to be here, nobody would care if I left, or things along those lines, those can be outcries that I need help. Don't ignore them. That's the important thing, and sometimes they're just like kind of off the cuff or parting door comments or things along those lines that particularly kids might say, but they're reaching out to you and they're asking for help. And so you can't ignore those things. Get them help, call 911 if you need to do that. Get them in to see a counselor. If you're not sure what direction or what's going on, get in touch with your primary care provider for your child. Give them a heads up prior to coming in, because then that way they kind of know the direction that you want to go, and they can help to lead the conversation while you're there. And that's really important. And then that way they can help refer you to someone that can help you and help your child.
And oftentimes, we talk about young people being at the forefront of mental health struggle. They're often trying to figure out their identity and other causes that could be contributing to that struggle with mental health. But it doesn't necessarily affect just that group. I mean, we can have coworkers, friends, and people in our lives that are also impacted by this. So let's say we see those warning signs. How can we reach out to this adult now and help them?
Well, I honestly and truly, to me, in my mind, the adult's not a whole lot different than your child. I mean, showing that you're concerned, showing interest, that you're really interested in them and what's going on and how you can help. Not going deeply into questions and trying to get all up in their business, but I think if you can just give them sort of a shoulder to lean on, that can be very helpful. And sometimes telling a story about a personal experience helps as well, because perhaps at some point in time you were going through a very difficult experience, and you went ahead and you had some counseling, or discussed it with a counselor or clergy, or somebody else that supported you and helped you through that time. Share those stories, because it makes people realize, hey, I'm not the only one, because you're not the only one. And I think that if we can support them so that they have sort of the get up and go and get help, then I think that we've done what we need to do.
Are there any wrong things that someone can do when they're trying to help someone struggling with mental health, or incorrect dialogue that can be had that's more harmful than helpful?
Ignoring them, I think, is probably the most harmful thing you can do. Support them and listen to them, and really listen. Don't impart your own feelings. Listen to what they're saying, and listen to whether they are reaching out for help or not. And if they are, try to help them to get that help. Don't ignore any information that makes you, kind of sends up the hairs in the back of your neck and says, oh, something just doesn't sit right. You want to make sure that you're helping them and getting them care if they need care. It's better to be wrong, I think, in a situation like that than to not do something and then kick yourself later. The other thing is, you're not wrong in trying to help anybody ever. So don't kick yourself for doing things like that either. Support, listen, handhold, do whatever is needed. Sometimes it's a very tearful experience, and the two of you may cry together. That's okay. There's nothing wrong with that. But listening and being a good friend, being a good parent, all of those things are important.
I think a side of mental health that we often don't talk about, we talk about helping other people in our lives and being there for them, and that's often an easier step when you're not struggling internally. But then there's the side of things of how do you deal with your own mental health when you don't have a support system there for you? So looking internally, how can people reach out for help with their mental health if they're just feeling like nothing will make them better?
It's really interesting, because one of the things that United Healthcare has done for our members is an app called Sanvello. And Sanvello is someplace where you can go. It's kind of like a one-stop shop. You can do some screenings to look at, are you having depression or what have you? You can go there to find like meditation and mindfulness things so that you can really kind of get your well-being back. You also can use that app to get to counseling if you think you need it, or you need to talk to somebody about, do you need to talk to somebody? And so Sanvello is the one that United uses, but I'm sure there are others out there. There's a lot of apps now for meditation and well-being, and that really is, I think, important for a lot of people to do daily, so that you just kind of get a grip with what is your well-being and what is not, and ways to handle stress. And, you know, you always have to throw in the old exercise. If you exercise, that helps your stress. Making sure you're eating right, that helps your stress. Drinking lots of water helps your stress. But, you know, you can Google help to control my own stress, and you'll come up with all kinds of things these days. You know, but I can tell you, Sanvello is a way that something you can utilize that for sure we've looked at United, that we've affirmed that it is very useful to our members, patients, and really to anybody.
And why do you think professional resources like the one you mentioned can do a lot more to help someone than, let's say, just leaning on a friend temporarily?
Well, first of all, it's specific for mental health. And so in the privacy of your own home or wherever, you can just get your phone, get on the app, and start kind of diving in. It can ask you questions about how you feel and what your thoughts are and those sorts of things. And it can make suggestions to you, things maybe you could do for mindfulness to help deal with the stress in your life. We all have stress in our life. And teach you better ways of coping and those kinds of things, which sometimes, you know, a personal friend is good to lean on, but they may not have all of those types of techniques unless they've really investigated or learned them. So an app like Sanvello can teach you those things. And once you learn them, you can share them with your friends. And so that's why I think something along those lines may be helpful. And you can, you know, if you're a private person, you can do it privately, you know?
Absolutely. Very well said, Dr. Lucinda DeMarco. I wanted to make sure we didn't leave anything out. As we talk about World Mental Health Day, something we touched upon at the beginning of this interview was the importance of a day like this to start a conversation or to continue a conversation around mental health, because that's not often something that's talked about. What do you want people to take away from this day?
Basically, talk to your friends and your family, always. You know, it's really important to be cognizant of those around you, whether they've got good well-being or not good well-being, and know what their baseline is so that if things change, you can bring it to their attention and help them. Lines of communication is always important, and the more you can communicate, the better.
Dr. DeMarco, I want to thank you so much for your time and perspective. And of course, this full interview, along with more resources to mental health, are going to be on our website, atlantanewsfirst.com. Thank you.
Excellent. Thank you.